This year has been the year of our emergency response solution.
We had a high expectation in terms of reception.
Why don't we already have medical record systems that are widely used in hospitals? Like, this should exist. My name is Ogenetic Tojare, and I'm the head of product at Helium Health.
My name is Tolagbe Martins, and I work in the public sector growth team.
I'm Peter Ame, a medical doctor from University of Ibadan, your state.
My name is Ralph Oluwole. I'm the head of private sector growth at Helium Health. And my journey with Helium Health started in 2016, which was when the company launched operations.
I joined in 2018, I think February, and we're still a young startup and we had just one product, that was the EMR. And we're probably in about 8 hospitals at the time.
Electronic medical records, as EMR, has been a lifesaver. Usually you want to come to the hospital, you'll be thinking of how you get your records, and that takes a good amount of time. Because it's paper, that means somebody has to come in to search for your name, your middle name, your surname, to make sure we, match the exact person with the exact record. Now, we're looking at a scenario where you have a lot of people. At a time, you can have 500 patients in a hospital. So getting that file is going to take you an hour to, if you're lucky, sometimes 3-4 hours. And if they don't see your records, you have to wait. You have to go open another file. That was the problem we were having in Nigeria, actually. With the EMR, you have a lot of information that you can see at the tip of your fingers, so you don't have to go look for people.
Our job or our mandate is to drive the adoption of technology in the public sector.
And what that entails is me managing the private sector growth team and ensuring that private sector facilities such as clinics, hospitals, laboratories, pharmacies get to use our products.
We believe that using technology will improve overall healthcare outcomes. Medical data or healthcare data is actually valid for planning everything and anything that you're doing. If you've seen that there's a spike, for example, of children being born in a particular local government area, then the logical place to put the next school, if you're trying to decide between do we put school in A or B, you have this data to inform the decision.
I wanted what Helium was doing to exist because it just felt like a no-brainer. Why don't we already have medical record systems that are widely used in hospitals? Like, this should exist.
I joined Helium in the middle of a pandemic, which was very interesting because obviously healthcare has been at the forefront of everybody's mind recently.
So with the advent of the pandemic, we've been having to work from home. And this means we have like a lot of, online meetings on Zoom or on Teams.
Government officials are ready to do work remotely now because before you would spend all your time traveling to see someone. And so it's been a real welcome development, and I hope it will stay post-pandemic, that at least some meetings can be emails or can be a Zoom call. That's been really refreshing.
I am probably in meetings with other teams, marketing, sales, just trying to understand what they're working on and all that, and also working with my teammate, other PMs like myself.
To our core products, the EHR and HMIS solution, which we launched with, I would say we had a high expectation in terms of reception when we started out in 2016, but then when we got into the market, we didn't get the kind of acceptance that we desired at the time.
We have 2 deployment models for the EMR. We could deploy the EMR on the cloud, which means the facility have a unique URL to access the application. And we could also deploy the EMR on-premise.
And it was for several reasons. So we started out with a cloud solution, but internet in Nigeria at 2016, 2017 wasn't that great. So we had to iterate and create an offline solution, which got even more acceptance. And between then and now, we've been able to take over 300 facilities digital. So we've been seeing like a lot of growth year on year.
The challenge has been to convince the providers and the payers in particular that we must be involved at inception stage and in planning stage. There is a lot of work on our part to do in demystifying it and making it clear that it's actually quite easy to use. We've spent a lot of resources making sure that our user experience is as seamless as possible. We've also gone a step further in acknowledging that we have certain infrastructure deficits. So we work to make sure that your solution and the devices are robust enough to go through power outages, and whether that's by actually providing you with a solar system, an inverter system, a battery, a physical server within your premises, just so that your data integrity is as important as possible and that you are not going to lose anything when there is no power.
The major requirement for us is the willingness from the facility, because we are able to help provide support, in assessing the other devices that will get the hospital running and go digital.
So our products can be used independently, but the real benefit is to then see how everything connects together.
Due to the pandemic, we realized that a lot of hospitals have seen a shortage when it comes to revenue, which was caused due to the fact that patients were worried about going to the hospitals. There was also the government imposed lockdowns as well. We then had to launch our telemedicine product in response to the lockdown, and which saw a lot of hospitals come on board. We got over 200 facilities during the period using our platform. We started out with our core solution, which is our Helium Electronic Health Records and Hospital Management Information System. Healthcare facilities in Nigeria are not, given a lot of attention, when it comes to financing. The options, they have for financing are very limited.
And that's why we started Helium Credit. And what that lets us do is provide short-term non-collateral loans to healthcare facilities, not just hospitals now, but pharmacies and labs. So
Helium Pay was born out of the need for us to, connect the monies that healthcare facilities receive versus what they process using our application. We've also created a wallet for them called Helium Wallet, which is where they receive all their monies. And this wallet accepts payments from USSD, from a POS which you provide for them, through bank transfers as well. So they can do everything using Helium Pay as far as collections is concerned.
We've seen that there's a need to assist physicians with tools to provide better care. So because you use the Helium EMR, it's easier to give you a loan because we can sort of use that data on you to decision certain things, right? Because you use the EMR, you have access to patient portal and all that. So while we offer them as separate products, they, in some cases, we still sort of bundle them together when we offer them to our clients.
It will always be relevant if you're trying to make sure that from an overall public health point of view, you know exactly what's going on and you're able to isolate, treat, and sort of provide a very targeted solution.
The long game for us really in 2021 is to then expand into different regions, East Africa, North Africa with our current product suite and also new products that are needed within those different markets. So that really excites me. And also with the partnerships we're going to be having with other healthcare players, because we can't do this alone, right?
I look forward to the day where, Helium Health would be that absolute bedrock that provides the healthcare technology infrastructure that powers the entire sector.